What's up, everybody? Welcome back. I'm Dr. Meathead, and this is another Meathead Minute. Today, we are going to answer a question that I've had a lot of people ask me recently. I don't know why this has been coming up, but people have been asking me, both for strength athletes and for your average person, what's the most important muscle group to train? This is kind of a loaded question. Obviously, the body is a unit. It's a continuum. There's no one muscle group that's the one muscle group that you need to train. And I know the easy answer is the stabilizing musculature of the trunk, as far as creating intra-abdominal pressure and bracing and things like that. And I think that's probably true. That's probably the number one most important muscle group. That being said, most people are already doing some type of direct core work, and yet you still see a lot of people coming into the clinic with back pain, or they're being prescribed core work. I hate the word core, but that's what we're going to use for now. Trunk stabilization work. They're being prescribed that, and it's not improving their pain. They're still having lower back issues, or they're still not stable underneath the bar. And that's because of what's probably the second most important muscle group, but for our purposes, this is the one we're going to talk about today, and that's the glutes. Gluteus minimus, maximus, medius, and other muscles in that hip girdle area, probably the most underrated and important muscle group when we're talking about long-term function and prevention of back pain. As an osteopath, I see a ton of back pain, and what I see a lot is an anterior pelvic tilt. So that means that the top of the pelvis is shifted forward. You often see it in a lot of Instagram videos or Instagram pictures with these models kicking their booty out, having that hyperlordosis of the spine. But it's actually a really problematic position, and can cause a lot of low back pain if you are constantly walking around like that. And if you're obese, have a large belly, something we run into a lot in our country at this point, you're going to be in that anteriorly pelvic tilted position, and you're probably going to have some back pain. Good way to combat that is not necessarily to train the muscles of the spine or train the muscles of the core. That's not going to shift you out of that position. That position can only be shifted out by posteriorly tilting the pelvis and extending the hips. What muscles do that? The glutes. Try to get in an anteriorly tilted position and contract your glutes. It's almost impossible. So all these people with this tilt have really, really poor glute strength, and thus they take over with their lower back, they take over with their hamstrings, and those muscles get really, really tight and can result in a lot of pain. So the glutes need to be trained. They need to be targeted specifically. Not everybody can do back squats and deadlifts and things like that. I mean, I should hope most of you can get in those positions, but oftentimes those aren't enough to train the glutes. There's a lot of trainers out there who have made a living off of just the glutes. There's all these booty boot camps, and you've got Brett Contreras, the glute guy, shout out to him. He is preaching the gospel of glute training and hip thrusts specifically. And these are things that all people, not just strength athletes, should probably be included in their training. When your glutes are strong, it helps pull you out of that anterior pelvic tilt and can really stabilize you underneath the heavy load. Try and press something heavy overhead without squeezing your glutes. I promise you won't be stable. Try and lock out a heavy deadlift without squeezing your glutes. You're either going to hurt your back or you're going to be really unstable. There's so many things that training your glutes and strengthening that area can do for you that oftentimes people don't apply. I have had a lot of patients that I've prescribed glute work to that come back to me, even though they've been doing core work forever, they come back to me after the glute work and their back pain's better. Especially in pregnancy, because the anterior pelvic tilt gets even worse, the glutes need to be strengthened. I could go on all day about the glutes and how important they are, but let's just break down a couple of exercises you can add into your training. You can look these up on YouTube. There's tons of good videos. Brett Contreras is the guy to look at for good technique. Hip thrusts, frog pumps, any variation of those things. Walking lunges can get a really good stimulus in the glutes, depending on how far you push your knee forward. Those are kind of the big three glute exercises that I personally like. Obviously, your back squats, your deadlifts, those are gonna work your glutes. But you need to target these things specifically if you want to get the maximum performance and also maximum back health. lower back pain is a huge cause of morbidity in this country, and it can really mess with your life, your work, your training, etc. So strengthen your glutes, don't get back pain. All right, guys, that's all for now, and I will see you next week for another Meathead Minute. Take care.